Dr. Rafich here from Vet Triage. We are continuing on with this issue of JAVMA from October 2016. We are going through a article called "What is your diagnosis?" and let's get through it. So these are radiographs here, these two here, of a 5-year-old female spayed Shar-Pei cross presented to the emergency hospital and referral center for inappetence, vomiting, polyuria, polydipsia, and melena, 3 days duration. This comes from a specialty hospital in Ontario, and one of the authors, Dr. Ringwood, actually was at the Long Island Veterinary Specialist before I got there. Right before I entered that facility, he exited, and just a interesting note there. This is the lateral plane abdominal radiograph of a dog. The head would be over here, tail over here, and you can see the arrows are showing this gas-filled mass in the ventral caudal portion of the abdomen. Here's the ventral dorsal view, same dog, head would be up here, tail down here. Presumably this would be right and left, and then there's the same gas opacity here. They found mild discomfort on abdominal palpation and a mass on palpation of the abdomen. Complete blood count showed leukocytosis. So remember, with leukocytosis, there's only 3 causes of it. It's either going to be inflammation, infection, or cancer. And you want to characterize leukocytosis by what cell distribution makes up the leukocytosis. So neutrophilia, monocytosis. So right off the bat, when you see neutrophilia and monocytosis, you should be thinking either it's a partial stress leukogram or a stress leukogram. It could, of course, also be infection or inflammation or cancer related, but usually if you have normal lymphocytes, normally eosinophils, and elevated monocytes and neutrophils, you're thinking probably partial stress leukogram. High aspartate aminotransferase, high alkaline phosphatase, and elevated bilirubin. So right off the bat, you're thinking about liver involvement, but you want to break it down. Aspartate aminotransferase can also come from muscle tissue as well as liver, and I think uterus too. But this is a spayed female. And then alkaline phosphatase can come from bone, liver, and most of them from liver. It's coming from the bile canaliculi, or it could be stress induced. And then the hyperbilirubinemia, I have a video on my channel describing that as well. You should divide that into pre-hepatic, hepatic, and post-hepatic causes. Pre-hepatic are things like immune-mediated hemolytic anemia, so destruction of red blood cells, or as an example, primary hepatic could be anything from hepatitis to cancer, etc. And then post-hepatic are things like pancreatitis, or anything that causes biliary duct obstruction, cholestasis can cause that. Hypoproteinemia, so with low protein, you're typically thinking that it's either loss of protein or decreased production or decreased intake or increased loss. And you have to think of, okay, well, there's a bunch of proteins in the body. We typically will measure on a complete blood or on a biochemistry profile the albumin, and so in this case the albumin is low, and so it could be either the dog is losing albumin, or it could be an acute phase reaction where the body is fighting something serious and is reallocating its resources such that albumin production is going down and a production of another protein, probably immunoglobulins, is going up, but you still have this issue of low protein, which means that whatever the cause is, either it's multifactorial or the body hasn't been able to rebound from the low albumin to produce the immunoglobulin sufficiently enough to make the protein levels normal or high. Hyponatremia, low creatinine, and hyperglycemia, as well as hypocalcemia. They moved on to ultrasound, and so this is the ultrasound images here. This is thickened small intestine, and this is going to be an enlarged lymph node. I also forgot to mention on the radiographs is loss of serosal detail. The problem here is that these radiographs are not very good quality, which I'm a bit surprised from a referral center. It is 2016 when this was published, so It's possible that technology is just better now at this hospital or whatever, but these radiographs are not good quality. Or just didn't print out well in the magazine, but all right. So they ended up going to surgery, exploratory laparotomy. They found that at the caudal duodenal flexure was a 6 centimeter intestinal perforation and omentum adhesions thickening. There's a mass there. They did intestinal resection, anastomosis of the duodenum. They also biopsied liver and lymph node, and all of it came back as high-grade malignant lymphoma or lymphosarcoma. They performed thoracic radiographs after surgery. The dog was not doing well 3 days post-op. They found pulmonary edema, and then by day 4, the dog became neurologic, and they euthanized it. Comments. Lymphoma of the gastrointestinal tract accounts for 5 to 7% of all canine lymphomas and is the most common type of GI tumor in dogs and cats. Dogs and cats with intestinal lymphoma may also have concurrent enlargement of liver, spleen, and lymph node. Gastrointestinal lymphoma in dogs is a severe disease with poor to grave prognosis. Median survival in dogs with chemotherapy is 3 to 14 weeks. Another study found that 56% of dogs with gastrointestinal lymphoma achieved complete remission when treated with multi-agent chemo. Overall median survival of 77 days, still not very good. And that studied dogs that failed to achieve remission or had diarrhea at initial evaluation had shorter survival times. Abdominal radiographs may reveal an abdominal mass in up to 40% of affected dogs and cats, and an obstructive pattern might be visible in 10 to 75% of cases. Intestinal lymphoma may be more difficult to identify on radiographic images because it can manifest as diffuse intestinal lesions. This is just an example that's more straightforward of an obvious mass in the abdomen. This is splenic mass. It could be liver, it could be intestine, lymph node, etc. But most often in this region, especially in the absence of a spleen, you're probably thinking this is a splenic mass. But just to give you another example. Hepatomegaly, splenomegaly, free abdominal gas, and peritonitis can all happen. Secondary metastasis to liver and lymph node, which are the most common sites of alimentary lymphoma. A loss of intestinal wall layering observed on ultrasound has a strong predictive value in distinguishing intestinal tumors from enteritis. Most lymphomas originate in the submucosa of the intestinal wall. That's why endoscopy may miss the diagnosis, and you need to have full thickness biopsies to confirm it. So that's it. Pretty straightforward. I think the uniqueness of this, it comes in that the radiograph showed a gas-filled mass. And, so you're thinking like abscess or an intestinal mass with necrotic center or maybe it's a very severe focal dilation of intestine. But otherwise, this is a pretty routine case. But I think that's probably why they decided to publish this one. So, all right, thanks for supporting the channel. We'll see you tomorrow. Bye-bye.